Hi, I'm Nina Flaherty. In this video, I'll be discussing the findings of my research project on whether a poor night's sleep impacts resting and exercising values for patients with lung disease. I chose to do this project because clients reported feeling worse and struggling to exercise after having less sleep. It is important to know if this is just clients' perception or whether we as exercise physiologists need to be wary of clients when they've had a poor night's sleep. The most common results from previous studies on sleep are hormonal changes and an increased perception of effort. Minimal differences were found after a single poor night's sleep. However, increases in blood pressure and heart rate were found in those who have cardiovascular diseases. No studies on the impacts of sleep on lung disease were found. The study was observational, with no changes made to the subjects' exercise programs. The subjects were clients who already attend the Lungs in Action exercise group in the University of Canberra Health Clinic. 11 subjects were included, 5 with COPD, 3 with pulmonary fibrosis, and 3 with severe asthma. They had an average age of 74.6 years, and their values were taken once a week for 7 weeks. The values taken at rest were blood pressure, oxygen saturation, and heart rate. The values taken whilst exercising were oxygen saturation, heart rate, and rate of perceived exertion. Clients were asked each session upon entering the clinic, "How many hours do you think you slept last night?" Then their blood pressure, oxygen saturation, and heart rate were taken whilst seated. The first values were recorded regardless of whether they were initially high and required rest before exercising. The second lot of values, oxygen saturation, heart rate, and rate of perceived exertion, were taken in the last minute of the aerobic portion of each individual's exercise program. No one was unable to perform exercise when they attended. However, some clients joined the study later, and some clients were away at various points throughout the 6 weeks, which resulted in a total of 51 datasets. The datasets were sorted into 2 groups for significant difference testing, with 16 partial nights sleep and 35 full nights sleep reported. A full night's sleep was considered as 7 or more hours sleep, and a partial as under 7. The cutoff was changed from the original 6 hours as planned, as only 3 individuals reported having less than 6 hours sleep. Naps on the day were included in the hours, naps on the previous day were not. There was a significant negative correlation between the number of hours slept and exercising heart rate, and a significant difference between resting oxygen saturation and exercising heart rate for a poor and full night's sleep, with resting oxygen lower and exercising heart rate higher after a poor night's sleep. None of the other values had significant correlations or differences. Ideally, to get the most definitive results, this study would need to be conducted again with a paired sample t-test, as it is not accounting for the fact that some individuals may sleep less than others and have higher resting and exercising values regularly. However, only half of the subjects had poor night's sleep, and the data would not have been sufficient. Also, as the hours of sleep are only reported rather than recorded at the time, there will be inaccuracies. It is very hard to judge your own amount of sleep, especially if the sleep is interrupted, which it was for the subjects on many occasions. Additionally, clients have multiple pathologies and medications which are hard to account for. If this study were to be used on its own, it would show that whilst exercising heart rate may need to be monitored, there is very little risk in exercising with limited sleep, even with initially lower oxygen than usual. The individuals that may be most at risk would be clients with lung disease and cardiovascular disease, in which case precautions and monitoring would be recommended whilst the client is exercising. Thank you for listening. I hope you enjoyed my presentation, and a big thank you to all that helped out along the way.
Created using Powtoon.